Welcome back, folks, and thanks for sticking with us this Sunday morning. Up next, as you know, November is Diabetes Awareness Month, and we are sitting down with Mini Garces, and we are talking a little bit about what you can do at home, different steps you can take, and things that you should be looking out for, maybe for yourself, for different loved ones. So first off, Mini, thank you so much for coming in this morning. We appreciate it.
Thank you. Good morning.
Thank you. So before we get into all the other details about just different things that folks should be looking out for, tell us a little bit exactly for folks at home, maybe what diabetes is and what it actually does to the body.
Okay, so diabetes is a chronic disease. What it is, it's basically, we all have an organ in our body. It's a pancreas, and this organ produces a hormone, insulin. So diabetes is when this hormone insulin, either you don't produce enough or the one that you are producing doesn't work, okay? And there are two types of diabetes. There's a type 1 diabetes. This is an autoimmune disease. There's nothing that you did to cause it. There's nothing that you could have done to prevent it. There's still a lot of research going on trying to figure out exactly why it happens. It's a lot less understood than type 2 diabetes. But these people, their lives depend on insulin and the insulin injections. And then there's type 2 diabetes. This is more of a lifestyle disease. Genetics does have a big role. Weight also has a big role in this, and that's the more common one that we hear about. The neighbor, your aunt, your uncle, your grandma, your grandpa. Type 2 diabetes, and this is really the one where you may be producing some insulin, but it's just not working, or over time you just lose a little bit of insulin production at a time. And there gets to a point where if you're just not producing enough insulin or it doesn't work, then your blood sugars start to go up. And it's not until your blood sugars go up that people get diagnosed with type 2 diabetes.
Definitely. And I know that that is, the number is pretty alarming. I believe the number nationally is 1 in 4 that people are diagnosed with type 2 diabetes.
Type 2.
And then I think the number locally is 1 in 3. Is it not in the Rio Grande Valley?
Correct. There's a high prevalence of type 2 diabetes in the Rio Grande Valley. There's two things that go kind of hand in hand. With obesity also comes the increased risk of developing type 2 diabetes. Most of the population in the Rio Grande Valley are Latinos, Hispanics, which is also a risk factor for developing type 2 diabetes. And in the communities, at times have been changing, but there's just, you hear from a lot of people, there's just not enough areas to exercise, or I don't have the time. So the sedentary lifestyle is like a physical activity, or just being too busy to work physical activity into your schedule also is a risk factor for developing type 2 diabetes. So it's just the perfect combination of genetics plus environmental factors that puts the people in the Rio Grande Valley at an increased risk of developing diabetes. And that's why we have a higher incidence than, than our area compared to the nation.
Definitely. And I know November is Diabetes Awareness Month, so I'm sure this month is, you guys are really going out into the community, really doing different things to kind of raise awareness and have that conversation with a lot of folks. Because I think a lot of the time people are afraid to know or ask any questions about their health because they're afraid of the what ifs, of maybe it's really, really bad and I'd rather not know, which is not the right approach to take on things. So I have to imagine that you guys are really going out there and doing the advocacy is really actually changing the way people are thinking about it and approaching their health care.
Exactly. If we're going to do anything about this high incidence of diabetes in our community, it does come with awareness. And I'm glad you asked me that question, because one of my passions besides diabetes care and treatment and prevention of complications is prevention of the development of diabetes. There's what's happening now is mom has diabetes, dad has diabetes, so then the kids, the children are at increased risk of developing diabetes because now they have 2 first-degree relatives with diabetes, and then, like I said, now you have the environmental factors, and that just keeps increasing and increasing the incidence of diabetes. So one of my main things is prevention of diabetes. And a lot of people can prevent diabetes or at least delay the onset, and it comes down to, there's no magic formula to it, but basically a healthy lifestyle, a healthy way of eating, and maintaining a healthy way to try to prevent the disease.
Most definitely. And it is, type 2 diabetes can be reversible with the, as you said, approaching a healthier lifestyle, eating better, doing more physical activity in your life. So I think that's really important for people to remember, that although you may get the scary diagnosis and you may think, oh no, is this it? What do I do now? Or instead of taking charge and saying, you know what, I'm going to change this, instead of thinking, oh, this is it, I'm just going to have diabetes and that's just going to be the way that my life goes. You can change things, and you can change your diagnosis.
You can. So there's so many advances in research and technology and medications. They practically come out with a new medication every other month. It's really hard to keep up with, but we try. There's so many advances that people do not need to develop complications. People should not be developing complications from type 2 diabetes. A lot of times you hear, well, I got diagnosed with diabetes, and then right away you start thinking of the complications. You start thinking, I'm going to end up on dialysis, I'm going to end up blind, I'm going to end up with an amputation of one of my extremities. But the truth is that diabetes complications can be prevented, and that's something that we really work really hard at. Like I said, there's so many programs out there that offer assistance to patients with their medications. There's advances in the types of medications. There's advances in technology that can also help improve the quality of life for people with diabetes. There's a device out there, continuous glucose monitoring systems, where people no longer have to be pricking their fingers, for 5-6 times a day to know what's going on with their blood sugars. So there's definitely the advances. And so people, if you do get this diagnosis, they need to know that, okay, what can I do from now on to try to prevent complications and get my diabetes under control?
Yeah, definitely. And I think it is all about having the conversation and being aware of what's going on with your body and being very in tune with it. And again, just maintaining a kind of healthier lifestyle. All sorts of little changes can make a great difference. So I think it's definitely best to kind of talk to your family doctor and kind of approach them and ask them, hey, this is what I've been feeling, what's going on, and just to really know your body, and then again live a healthier lifestyle for you, your family, and just an overall better life, quality of life. But I want to thank you so much for coming in this morning and sitting down and chatting with us. This is a conversation that we definitely need to be having, and I'm glad that we had it this morning. So thank you so much.
Thank you for having me.
Thank you. All right, folks, when we come back, we are sitting down with the folks from the Aurora House Foundation, so stick with us.